Hey, what are seniors doing to correct this catastrophic event that's happened in 2025? Thousands of seniors have lost their Medicare Advantage plan mid-year, and in the middle of this, they don't know what to do. Stick around, I'm going to walk you through exactly what happened and what to do to correct the problem. Hey guys, did you lose your Medicare Advantage plan and it vanished and you don't even know exactly what happened? Over 1.5 million seniors have been impacted by what's happened from 2024 going into 2025 this year. During the AEP season from October, November, December, or October 1st through December 7th, a lot of people didn't realize that they're going to be losing or their Medicare Advantage plan was being taken off the market. This has impacted 1.5 million seniors, and I'm going to explain exactly what happened and then what steps, if you have woken up today and don't have coverage, what can you do next to ensure that you're able to lower your costs and not be left with a lot of high expensive costs out of pocket. So I'm going to walk you through why exactly this is happening. One of the major things that you'll see here is CMS funding occurred last year and over the last few years. Right now, reimbursements are only projected to be about 0.16%, not covering the rising costs. So if you factor in the 4% inflation or cost of living adjustment across the board with any kind of entity, whether it be your personal bills or whether it be the government, you'll see here that funding is shifted, and so therefore it caused this trickle effect when it comes to not funding the plans enough. The fundings that comes into the Medicare Advantage carriers, they are having to pay out a certain percentage amount towards benefits, co-pays, co-insurance coverage, dental, hearing, vision, and things like that. And the Medicare Advantage plan or plans that are in your market or across the U.S. can only have a certain profit margin. Everything else has to go back in towards the benefits of the plan. Well, when there's been a reduction in reimbursement, it's lowered that, therefore putting that Medicare Advantage plan at a higher percentage rate of loss. Therefore, a lot of the carriers have pulled plans off of the market. So that's one of the reasons why CMS funding shifting has occurred. One of the other things that's happened is the Inflation Reduction Act that impacted the $2,000 drug cap. This new cost burden has been pushed back onto either the government and the Medicare Advantage plan themselves. So the Medicare Advantage plan is having to pick up a percentage amount that we'll talk about in more detail on another video. They pick up a percentage amount, and then that percentage amount, because it's increased now because of this new $2,000 max out of pocket, it has put a burden on, again, a lot of the loss ratios factored into the Medicare Advantage carriers. Therefore, they pulled plans off the market. So one of the other things is broker rule changes. So you'll see a lot of times on the news right now, and this is kind of being marketed online with other YouTube channels and things talking about Medicare. A lot of times guys that are talking that really kind of push Medicare supplements over Medicare Advantage, you'll hear these guys talk about some of the incentives have been reduced. So this dollar amount that's been given to agents, and I'm going to explain this a little bit more in detail on another video, but basically there has been incentives, and those have ranged anywhere from like a $50 up to like a $150 incentive, and this is typically associated around what they call health risk assessments. So HRAs are basically a list of questions the Medicare Advantage carrier has asked the agents to be able to ask, and that information goes to the carrier, it goes to CMS, and it helps the carrier basically regulate whether or not they're doing continuity of care and basic care needs when it comes to that Medicare beneficiary. Well, the carrier, because of loss of income of coming in from the decrease in funding, they are now adjusting and eliminating these HRA payments. Therefore, instead of just being an agent that has always written the right business, or if you have a client that's going on a Medicare Advantage plan, some of these agents that were dependent on this HRA for whatever reason began to pull back and not market and enroll people into plans, or they got frustrated with the carrier and maybe shifted their focus towards another carrier. Now what we're seeing is almost all carriers are eliminating the HRA incentive, whether you want to call it a bonus. It's just really an additional payout that goes to the agent for taking the 10 or 15 minutes of time it takes to do the HRA. So instead of the carrier paying somebody in a cubicle to call and make the call and engage with somebody to ask the series of questions, and if you've ever been part of one of these, usually it's asking if you have depression. It asks just common basic questions about your health, your weight, your height, your activity level, and just different elements and checkpoints, they are not going to be paying the incentives. Therefore, the agents are not going to do them. Therefore, that information to be extracted from the new client is probably going to go back to the carrier, which to me may end up increasing the cost overall. But this is one of the reasons that has occurred. So if you hear and watch YouTube videos or stuff on social media, and you hear educators like myself talking about the incentives, and this whole new spin now is there's this investigation with certain carriers that they've paid a high dollar incentive to, in a sense, what they call buy clientele, then there's causing problems with that, and I'll dive into that on another video. If you guys do have questions about that, you can always ask, and if you're dealing with a broker, they should be transparent on this information if you do ask. So one of the big things as well that's happened is really what we call kind of a policy overload, where Medicare Advantage carriers in given areas have had a huge influx of new enrollments in that area, and all of a sudden they've stopped compensation for those plans in that given area. So you may have, over the last 6 months, during the October, November, December timeframe, you may have experienced an agent looking at maybe plans and going, I'm not going to put you on this plan, but I'm going to put you on another plan. And maybe that was because there's no compensation tied to a particular plan, and they're putting you on one so they would be compensated for the enrollment. But what has happened is, because of the loss of influx of money coming in from CMS and the Inflation Reduction Act, and some of these pullback from some of the broker channel marketing Medicare Advantage plans or marketing Medicare health plans, there has been some situations where there's a policy overload in a given area, and all of a sudden it's put that carrier at a higher risk. So there's all types of different factors. I won't go into all of those on this video, but there's factors that allow that carrier to go, hey, we have too much business, and they'll pull a plan off the market, and then they'll help reassign those clients that are on that plan into maybe one or two plans, or do a crossover into another plan. And a lot of times they'll do that because another plan has a higher star rating, or they're bringing a plan in from a different market. Let's say I'm in the Tennessee market. There may be a plan in the Texas market that has a 5-star rating, and they're pulling that plan in here because based on that rating in Tennessee or Texas, they can pull that plan in here, have additional money paid to the plan because of its 5-star rating. CMS allocates more money for a higher star rating. So 4.5, 5-star plans get more money. They'll bring it into a market. They'll eliminate one plan that has a lower star rating, and they'll roll those people into a given plan, or allow that member to enroll into one of their other plans. And they usually will sometimes use the broker to do that, or they have a structure where they do a crossover. Well, in the middle of all that, what has happened is there's been policy overloads in places, and they just pulled policies off, and people didn't understand that they actually had to call in or call their broker and do a crossover walking into a new plan, and that caused a lot of this problem as well. Hey guys, so for you guys that don't realize, like, I am the principal broker of an agency, and I often say in our agency meetings, a lot of times, no profit, no mission. The lights do not come on unless the agency makes a profit. And so how we profit is actually by enrolling members into health plans. Now, we're an agnostic model. That means we'll enroll you into whatever plan's the best fit for you. That's kind of a no-brainer for us. And then we make a profit by the carriers paying in a commission, an allocated commission. A lot of times it's regulated by CMS pay structure, sometimes but it's all just kind of nickels and cents when it comes to the amount of money that comes in. I don't really look at that. I look at how many people do we help in a given year, and then from that there's profit, and then we're able to increase our customer service employees or bring on another licensed agent, depending on what we're trying to expand into. Well, one of the problems that we've seen and why this is happening when it comes to plans being pulled out of the market is that there's profit pressure on carriers like you see Humana, Aetna, WellCare exiting unprofitable markets. So in rural areas, if you live in certain rural states, Idaho, Wyoming, there's other states that don't have a huge presence when it comes to Medicare Advantage. You may see a lot more Medicare Supplement business or clientele in those states. And you'll see more clientele on Medicare Advantage in metro heavy populated states, like Tennessee is a heavy MAPD state. It'll have a lot of Medicare Advantage in this state with seniors, and they're happy. The networks are big and the access care is easy, so that's a great state for Medicare Advantage. But what will happen is in a state when there's not profit, there is no way to continue on with the mission of that carrier. Just like I say, no profit, no mission as far as our agency. If we weren't making a profit, we couldn't keep the lights on, therefore people wouldn't have a job. So part of this is because of the reduction of all this, there's been a pressure on the profitability of certain plans, and especially in rural markets or rural state areas where there's not a lot of enrollment status when it comes to Medicare Advantage. And we'll talk about more of this on another video. I'll break down some numbers and things like that on all of these. And then we're gonna move on to some more important information in just a second. So what happens when seniors are faced with their Medicare Advantage plan being pulled out of the market? One thing, there's a shortfall in Medicare Advantage plans, especially like I said, in rural areas, up to 60% fewer choices. So one of the things you're gonna see this year going into annual enrollment period, which is 2025, this year it'll be 2026 AEP, you're gonna see fewer plan options in rural markets. And what's gonna shift and change with that? We don't really know. There's projections on there's probably gonna be a little bit higher premium cost, higher deductibles, and then potentially for your PPO plans that are based in rural markets, a lot of times, you're going to see a higher copay cost and cost share, maybe a reduction in benefits like dental, hearing, vision, over-the-counter benefits and things like that. So if you're looking at Medicare Advantage plans and you live in a rural market and maybe your plan was pulled off, and again, it's the reality is a lot of people are going into their doctor, pulling out their Medicare Advantage plan in the middle of the year for the first time because they're healthy people. They don't access care a lot. They weren't paying attention to a lot of the propaganda that was out in the fall of the year communicating all this stuff, and you whip your card out and they say, hey, we're not taking, or that card has been, that plan has been terminated, and you realize, hey, I'm in the middle of the year and I don't have coverage. What do I do? And I'm going to explain that in just a second in a little bit more detail, but you need to be watching for the shortfalls or the suppression of plans in rural markets. And this is a great opportunity sometimes, instead of being on a Medicare Advantage plan, to look at transitioning into a Medicare supplement. Now, with the supplement, most of you guys, if you don't know, Medicare supplements beyond the age of 65, you have a 6-month window to enroll in that supplement without any underwriting questions. And beyond your eligibility window, if you're coming off an employer plan, you have a smaller window of time. I like to tell people, just use this for every rule. If you have 3 months before and the month of and 3 months after when you're turning 65, that's going to be the window that you would choose a plan. If you miss that window, you may have missed your enrollment window to eliminate all penalties. But you have up to another 3 months to enroll into a Medicare supplement. Now you're in the middle of this year, and we're going to be talking about some enrollment times and what exactly can you do here in just a second. I'm going to explain this in detail if you're finding yourself without coverage. So here in just a second, I'm going to go through with you, if you go back to original Medicare, what exactly is going to happen to you. Hey, so let's say you're right back on original Medicare. What has happened is, if you had a reduction, maybe they marginalized your MA or your MAPD, more than likely if you're on a Medicare Advantage plan. The PD is the prescription drug plan benefit. If you have realized all of a sudden you do not have any coverage anymore, you've automatically been re-enrolled into original Medicare, and you go back to original Medicare and you don't have drug coverage. So if you're going to the pharmacy right now and trying to get your medication filled, you're realizing you're paying basically 100% of the cost. Now, for you guys that may have taken a tier 1 or tier 2 drug, you're probably seeing those drug costs anywhere from about $5 to $20. This may be a good indicator if you've gone January, February, or March and got your medication filled, and the year prior when you were on your Medicare Advantage plan, your medication was less, now all of a sudden it's higher. The pharmacy may not communicate that your coverage is no longer working. You need to make sure you're aware that is your plan active. If it's not active and you've gone back to original Medicare, well, guess what? You do not have prescription drug coverage. You've eliminated that coverage. Therefore, what's going to happen is you're going to have some costs caused by penalties. So when you've gone back to original Medicare without picking up a prescription drug plan, you are going to be assessed a 1% per month accrued penalty that's going to be based off the national prescription premium average. That's roughly around 35 to 45 cents a month based on the national average premium cost per month. So you're going to pay 1% of what the national Part D premium average is for that year. That can change, but usually it equates out to about a 35 cent to 45 cent per month, and then it accrues for every month that you have not had coverage. So if you lost your coverage for your MAPD plan during AEP, that would have gone effective 1/1 of 2025. So what's going to happen here in a second, I'm going to show you when you can re-enroll, and you're going to go effective 1/1 of 2026. Well, you're going to have this 12-month gap. So you're going to have that penalty. If it's 35 cents, you're going to have a 12-month times 35 cent penalty added to what you're going to have to pay to have a prescription drug plan. So if you go back to original Medicare and choose to pick up a Medicare supplement and pick up a prescription drug plan, you're going to have a penalty. If you go back to another Medicare Advantage plan during this annual enrollment period that we'll talk about from October to December 7th, you're going to be assessed a penalty. You're going to get something from the federal government saying that you have a penalty. And I just want you to be aware that that penalty is caused because you're just on original Medicare. Now, if you did nothing, you didn't enroll into another plan, you've gone back to original Medicare. And I'm going to break down here in just a second the cost that's going to incur if you are accessing care between now and January 1st before you do make another plan change or selection, or you can do one other thing to eliminate all these costs. And you can do that actually today or tomorrow or sometime over the next few weeks to eliminate all these costs we're going to talk about in just a second. So Part A deductible for 2025 is $1,676. So if you're on original Medicare and you've gone back to original Medicare and you go to the hospital, you're going to pay this deductible if you go to the hospital day 1 through 60. Now, 61 days and beyond, you're going to have a dollar amount per day. I won't cover that. I get into the details of that on other videos. But the big idea is you're going to have this deductible. Also, you're going to have a Part B deductible of $257 if you access care outside of the hospital, plus you're going to pay 20% of the billable rate. So why is that important? Well, if you've been on a Medicare Advantage plan, you didn't have these deductibles. The Medicare Advantage plans don't have a Part A deductible. They don't have a Part B deductible. And typically, if you access care into a hospital, you're going to pay roughly around $300 a day, plus or minus. Or if you access care to like your doctor, your specialist, most of you guys have seen either a zero or a very small copay to access normal care or diagnostics like high imaging, MRI, CAT scan, PET scans, or blood work, lab work, x-rays, things like that. You see kind of a range of about 0 to the national average is about $150. Well, what I want you to make sure you're aware of is if you go to the hospital and you have this deductible, you're going to pay that deductible because that's based on original Medicare's fee schedule. If you go to something outside of the hospital, that's going to fall under Part B services. You're going to have that Part B deductible, and you are going to pay the 20% billable rate. So you say, Kelby, what do I do if I'm in this situation and I had a Medicare Advantage plan, I lost it, I didn't realize, I woke up, went to the doctor, now all of a sudden I'm getting these bills, and it's above and beyond what I would normally pay. What is an option that you can do? Well, on original Medicare, you can actually go ahead and enroll into a Medicare supplement, or some of you guys would know it as a Medigap. And on this plan, you're going to pay a premium. It's going to pick up almost all the deductibles and all the co-insurance, minus depending on what plan you go. But a lot of clients that we do plans with for Medicare supplements go into a Plan G. And then all you have is a Part B deductible. So the exposure there is going to be very minimum, $257 for this year, and everything else is covered 100%. Now, this is a caveat when it comes to going to original Medicare and going on to a Medicare supplement, you're going to have underwriting questions. So if you have health risk, and you've been in the hospital over the last several months, or you've had a major surgery, or certain health questions you can't answer no to, you're not going to be underwritten for the Medicare supplement. It's an underwritten product beyond 6 months when you first turn 65, or if you've lost credible coverage maybe you were on an employer-based plan, you lost credible coverage, and you're in your window of time to enroll into a guaranteed issue, that means you don't have to answer questions. You can go into the Medicare supplement. But for everyone else, you're going to have to answer those underwriting questions. But why is that important? If you've lost coverage and you're looking for an option, going to a Medicare supplement plan is probably one of the best things you can do right now. You can get into that plan, you pay a premium. The premiums are going to increase every year. I talk about this on a lot of the other videos that we do. And you're going to have insurability, so it covers the gaps in original Medicare and eliminates you from having catastrophic health coverage costs out there that can happen to anyone. All right, guys, so let's look at the step-by-step fixes that you can do. One, you need to confirm your current plan at either Medicare.gov or you can call 1-800-MEDICARE. You can also use an agency like us. We can actually look up and see what somebody's on and tell them your plan's active, effective whenever it was. But if you don't know, if you're uncertain, you're like, hey, I may have been in the situation where my plan was pulled. What do I do? This is a great way. Step 2 is act fast. So if you have a special election period, like you're coming off an employer-based plan, maybe you've had conjunction where you had a Medicare Advantage plan in conjunction with your retirement plan or your employer-based plan. I mean, there's all types of different situations. But if you're in a SEP or special election period time frame, you have 63 days from the denial or termination to be able to go ahead and take action towards enrolling into another Medicare Advantage plan, or you have the option to be enrolled into a guaranteed issue option for a Medicare supplement or what we call Medigap as well. MAOEP, January 1st through March the 31st, if you're still in the open enrollment period. Well, guess what? We're middle of the year right now, so we're past this. So if you're waking up and you're watching this for the first time, you need to understand that each year, if something happens during the annual enrollment period and you just don't catch it, and all of a sudden in January, February, and March, you learn about that, guess what? You actually have a 3-month window that allows you to make changes to things when you have not made that. Now, again, if it's loss of coverage, because a plan has been pulled out, you don't have that plan starting January 1st. You've gone back to original Medicare. Therefore, you don't have a Medicare Advantage plan. This OEP season works for those that go from a Medicare Advantage plan to another Medicare Advantage plan. So if you've lost your coverage, went back to original Medicare, again, you're going to look at the option of Medicare supplement or call and talk to a licensed professional to find out if one of these special election periods apply for you. Or step 3, you're going to choose your pathway. You're going to look at a new Medicare Advantage plan. If you've had one and you see there's something going on with plans, call your licensed agent, or if you don't have one, you can call us, schedule a review. It doesn't cost you anything. We'll walk you through, do a comprehensive review, ask you a lot of questions just to determine exactly what's the best fit for you, and then what's going to happen if this plan gets pulled out. You also have the ability to enroll into a Medicare supplement because your plan is being taken out of the market. It creates a guaranteed issue time period. So a lot of people have missed that now. They didn't realize that. They weren't educated properly because they didn't have a licensed professional or an agency like us to educate the client on what their options are. So if you've lost, or this year you are losing your plan, you have a lot of options that fall under. You just need to make sure you hit the window of October, November, December to make that decision. So effective January 1st, you have the right coverage and plan that's best for you. And then you can always go back to original Medicare, as we talked about, pick up a prescription drug plan, add a Medicare supplement within the guaranteed issue window because you're losing the Medicare Advantage plan. This is a great option if you're unhealthy, you've got health issues going on, maybe you've been paying a lot out of pocket for co-pays and network issues, or you just don't like the Medicare Advantage plan. If it's being taken off the market, Medicare gives you this opportunity to choose your pathway to a Medicare Advantage plan under a guaranteed issue, which is a great option for many people. Hey, so one of the things that I have to do on my phone for a lot of things is I actually have to open my phone up and go to the alarms and set an alarm to remind me of certain things each day or each week. I just forget things. Even if I'm at the golf course hitting golf balls, I have an alarm that goes off at 5:35, and that means I gotta get in my car and drive home because the dinner time is at 6 and I don't want to miss dinner time and make my wife upset. So these are ways that we can set parameters around maybe a calendar that you have and setting an alert for yourself to begin to start asking questions in August and September, and then making sure you've scheduled an appointment in October or November for a review so you're not caught off guard. Now, one of the three of the top searches in 2025, we did a little bit of research and wanted to find out what are the three top searches and what are probably the deep dive into these, which we're going to go over in additional videos. So once you watch this video, you need to be watching for these top searches and the deep dive into this. One is, can I switch my Medicare Advantage after January 1st? And we just talked about this a few minutes ago, but yes, the answer to that can be yes, and it can be yes, and then it can just be a flat no if you are being pulled off a Medicare Advantage plan because it's coming out of the market and you didn't take action October, November, December by the 7th of December, then you can't do that. But otherwise, January, February, and March, we're going to talk about this open enrollment period, more of a deep dive, and giving examples to you so you're educated about your options. So think about it from a standpoint of the OEP season is a great way, but that's one of the main searches people are asking. And then, you know, OEP deadlines for 2025. Well, OEP years ago when they rolled out this special election period, it was January 1st to March the 31st. And then there was a time period, if I remember correctly, they shortened that window back to like February the 14th. So there's like 6 weeks or 7 weeks, depending on the calendar year, that you had to be able to still change from a Medicare Advantage or Medicare Advantage prescription drug plan to a different plan if you didn't choose the right plan during the annual enrollment period. We're going to talk about this, but this is a major top search right now in 2025. People are asking like, hey, and why are they asking this? It all relates back to they didn't make a plan change and are trying to figure out how to change that. Then the OEP versus SEP difference. So this is something I'm going to go over in just a second in detail, which is very important because you may have not made the right choice in October, November, December, or any choice, and your plan is gone, or you're still on a plan, but you may have a special election that can be used that we're going to talk about in just a second. And then just a reminder, January 1st to March the 31st is your golden reset button. Don't miss that. Again, the OEP is just a reminder time, but if you miss it in October, November, December, for Medicare Advantage plans, you have that 3-month window to change that plan, which is very important to set yourself on a reminder and alert in case you miss it in the annual enrollment period. Don't miss that at the first of the year. So one of the major searches again in 2025 is what? Can I switch my MA after January 1st? And the answer to that is yes, like I said, if you're going from an MA to another MA plan, then you can go from one carrier to another carrier plan, a like-to-like plan. The next thing I said was yes, guess what? You can go from an MAPD plan to another MAPD plan, what I call like-to-like plan, but a carrier, let's say this is United Healthcare or whatever carrier it is, and you want to transition to another carrier. So you have a MA to MA or MAPD to MAPD. And then the no. What you cannot do if your Medicare Advantage plan has been taken off the market starting January 1st of that year, whatever year it is, you cannot go from original Medicare to another MA or MAPD plan. At that point, you have to either choose to enroll into a Medicare supplement plan, going through underwriting typically, or you're going to have to look at what we're going to talk about in just a second, your SEP options for going into maybe a MA or MAPD plan based on SEP options that we're going to talk about in detail in just a second. What are the deadlines for OEP? Just a reminder to make sure you understand. AEP is going to be from October, and I always like to say marketing begins October the 1st, and then your last decision that you have to make is going to be December 7th at the strike of midnight. So at midnight, if you have not made a plan decision change by the 7th, you are going to be stuck into going into the OEP time period. Now, what is the deadlines when it comes to OEP? Well, you go from the first of the year, from the January date, January 1st, all the way to March the 31st. And again, at the strike of midnight is when you're going to have this time period to be able to enroll from 3 months. So don't wait to the last minute. If you haven't changed or didn't change, or this upcoming year or coming years in front of you, always remember the deadline is always for AEP, the strike at midnight, the last day of that enrollment season. And for the OEP season, again, this is like to like plan change. You can go from January 1st to March the 31st. Now we're going to dive into the SEP options you may be able to apply for right now and go back onto a Medicare Advantage plan that's the best fit for you. So what are the SEP options or differences? OEP is the time frame. SEP is something that is happening in your life or a condition in your life that allows you to enroll into a plan. So one of the big things that we look at is a person qualified for a special needs plan when it comes to chronic conditions. So chronic conditions typically are going to apply to conditions like diabetes, congestive heart failure, or COPD. There's going to be respiratory issues, major heart issues, or a diabetic condition. And these are considered chronic health conditions. In your market, more than likely, especially if you're in a metro area, some rural areas will, but in metro areas, usually there are going to be a couple of different carriers that are going to have chronic special needs plans. Now, what is the benefit of these? Well, one, you're going to see a reduction in the cost of your medications. Most of these medications that manage, like COPD, my dad had emphysema, COPD. He died of end-stage COPD in his last few years. His health had gone down, but for years, my dad was on at least 3 name brand inhalers, and those inhalers are very expensive on any drug plan. So one of the things that chronic needs plans will do is they take the drug cost and they actually lower this drug cost for people that qualify. Another thing is access to care for certain conditions for chronic needs can lower or suppress the copay cost to access care. So it basically, what it does is it kind of incentivizes this person that has these conditions with their health, it kind of incentivizes or encourages them to access the care they need. So it lowers their basically what would be considered medical loss ratio. So what does that do for the plan? Well, that increases profitability. And as we talked about earlier, when these plans increase profitability, they have to put it back into the plan benefits. So what does that look like for these plans? Well, reduced cost in your drugs is one thing, and then additional benefits. One of the things that goes on with these plans is they'll increase the benefits when it comes to what the plans provide. Now, SEP options, loss of credible coverage. One of the things that can be happening to people is they've had some form of credible coverage, or you still have credible coverage, and maybe you're coming out of that credible coverage. This would be like a retirement plan, or typically it's going to be a loss of work and you've been under an employer-based plan. Another one that's important to remember is you moving from an area. So if you move from Southern California, from the beautiful shores of California, and you said, hey, I'm not going to pay the taxes and the income taxes and the property taxes here anymore, we're going to sell our property, we're going to move to Tennessee. You move to Tennessee. Now, when you create a move from one county to another county, you actually create this SEP, and Medicare allows you to enroll into plans that are available in this county. That is a very important one for you guys if you're moving into an area. Another thing that is very important to remember with SEPs is Medicare can actually give you a special enrollment period. And a lot of times that's based on scams. If you've been part of a scam, maybe you got a call, a text. We were just laughing yesterday because we kind of joke around in the office a lot, but like there's been a lot of scams, calls. You'll answer the phone and it's somebody talking, they'll say, you know, you need to acknowledge this purchase on your Amazon account, or you may get a text and it asks you to acknowledge something. Well, in that, you may have gotten a text, a phone call, somebody talking on the phone that sounded very normal, professional, but all of a sudden you've realized in that scam that you had one plan, maybe a Medicare Advantage plan, and now all of a sudden you have been eliminated off that plan and they put you on a different plan. And now the problem with this plan is the costs and or the benefits on the plan have gone, the cost has gone up, the benefits have gone down, and you have been scammed. You're frustrated. Well, what do you do in a situation like that? Well, you're going to call 1-800-MEDICARE. And you can actually file a request to have a special election period, which will give you the opportunity to enroll back into that Medicare Advantage plan or another plan, eliminating the scam that's happened to you by an SEP option. So if you have questions about that, always reach out. And now we're going to finish up with just one more thing that's very important for you to understand. Hey guys, so last thing, if you do not have an independent insurance brokerage that specializes in Medicare health plans like we are, I would encourage you guys to schedule a time to be able to call. Or if you're saying, hey, I need some additional information, Kelby, I'm turning 65, I'm coming off an employer-based plan, I'm still confused about the whole Medicare thing, I've watched some of your videos and I'm wanting a deeper dive into understanding Medicare, I would invite you to be able to sign up for one of our Medicare Made Simple workshops. We have an on-demand workshop, a live workshop. The link is going to be below in the description. Click sign up. We'd love to be able to educate and provide any resources. And then if you have any additional questions, do reach out to us. We're here to be able to educate and guide you through the process to eliminate the confusion about Medicare. And as we like to say, to make your life easy by making Medicare simple. Until next time, we'll talk to you soon.